The second nationwide lockdown has been extended in Kazakhstan. The number of single-day infections has surpassed 1,500 for 12 consecutive days. The country has also registered 135,000 cases of pneumonia since July 1st. Last Friday, Kazakh Health Minister Alexey Tsoy said that these numbers will be included in the official COVID-19 statistics. To discuss the public health crisis here in Kazakhstan, I am joined today by the head of the country office of the World Health Organization, Dr. Clarinval, and technical officer, Dr. Vitalii Stetsyk. Dr. Clarinval and Mr. Stetsyk, welcome. Dr. Clarinval, well, Kazakhstan is now in the top 30 countries, according to the Johns Hopkins University, in the top 30 countries according to COVID-19 infection spread rate. We have been one of the countries that have dealt with the situation well in spring. We have reacted promptly. We have kept our numbers fairly low in spring when other countries were actually having their highest numbers. What went wrong? Where did we fail?
So we can see that from WHO's perspective is that globally their countries evolve in a different way. And indeed, Kazakhstan has put an enormous amount of effort into not only responding to the outbreak, but also preparing for it. And I think it's important that we remember this, that there was a colossal effort done by the Ministry of Health, the government, and more particularly by the healthcare workers, in order to understand what is going on, what kind of disease is it, how are other countries responding to it, how can we prepare ourselves best for it, and what is most important for the context here in Kazakhstan. What I've observed is that oftentimes they've asked me, say, Caroline, what's the right way to do it? How can we do it in the best way? How do other governments do it? And my message oftentimes was like, look, these are WHO's guidelines. According to them, what we now have to look into is we have to contextualize them to Kazakhstan, because Kazakhstan has its own features and own particularities. What we could see at some point is at the moment from the beginning of June, which somehow correlated with the end of the previous quarantine and lockdown, is that there was a spike of the numbers of cases of COVID and of the number of cases in pneumonia. What we can sort of bear in mind is that how has the population responded to, how have they behaved ever since? Depending on the population's behavior and depending on the ability of a health system to take care of those patients, there might be a spike or a decrease in the number of cases. So for Kazakhstan, I think it's important that we remember that there was enormous effort done in order to contain the disease, in order to make sure that this epidemiological curve remains small. The government has done an enormous amount of tests. They've done over 1.6 million tests of people and patients. At the same time, then the question is, what were the precautionary measures that the population has taken in order to protect themselves from getting infected once the quarantine has been lifted? So we have to bear in mind that the way this disease is evolving in Kazakhstan is very similar to how it evolved in other countries. So it's nothing particular to Kazakhstan. It's something that we can absolutely expect, and it's something that we have to be prepared for, and it's something that we have to bear in mind.
What were some of the behaviors that have actually led to COVID-19 spread or to the spike in the numbers?
Since the beginning of this disease, we have our colleagues in headquarters, Dr. Mike Ryan and others, that keep reminding us of what are the key principles or key precautionary measures that a person can take in order to avoid being infected. And they are very simple measures, such as hand hygiene, respiratory etiquette, physical distancing, remaining home when you fall sick, etc. Call your healthcare professional once you are sick. So there's a number of very simple recommendations. The problem with them is that they're very difficult to apply on a daily basis. Okay, even myself, although I spend my time disinfecting my hands X times per day, I still notice that there is this moment where in the end I will touch my face. So what we have to do, we have to remain very aware of how can we prevent infecting ourselves, and how can we then make sure that we also don't infect others if we have the belief that we have been exposed to the disease. So on one side it is, what are the measures that the population can take? How can the government ensure that those measures are actually being transmitted, that the population is aware? How can we, from a communications perspective, ensure that every person knows how to appropriately wear your mask? Because many people wear masks, but they wear it inappropriately. Sometimes they handle the masks inappropriately. So there's lots of little things that the population should actually be made aware of. So on one side, there's this responsibility to make sure that everybody knows. And once the population knows, it's a responsibility of the population to actually abide by those principles to the best of their ability. And again, then comes in the human factor. And I do believe that there is a certain limit to what it is that we can't do. And I also believe that we have to just realize that we are in a situation where there is a disease outbreak. We can take a certain number of measures in order to protect ourselves and in order to protect others, but there is still the risk of us to fall ill. And then it's important that we don't stigmatize one another, and that we make sure that if someone's ill, it's not their fault, and that we then find a way on how we can support that patient best.
How is the pre-symptomatic and never symptomatic transmission playing into the bigger picture?
So for the moment, we are still looking into the matter of the asymptomatic and pre-symptomatic and symptomatic patients. When it comes to the transmission potential, what we have learned, what's available at the moment, is that the transmission might occur between the patient who is infected with COVID and the healthy individual a few days before the clinical onset, before the person is becoming asymptomatic, and during the time when the person is having respiratory symptoms. So basically, since at the moment we have evidence in our hands that the SARS-CoV-2, the virus which is causing a disease, COVID-19, has a droplet and contact transmission ways. So basically, when a person with COVID-19 with symptoms with respiratory symptoms is coughing or sneezing, there are small droplets which are exhaled, and those droplets they travel at the distance of up to 1 meter, and the same droplets they are pretty heavy comparing to other particles, so they settle on the surfaces, and then when people are touching those surfaces, those droplets are settling down. That's how the other people have a potential of contracting COVID-19. So for the moment, that is why WHO recommends it's pretty essential and fundamental ways to protect oneself from getting sick with COVID-19. That is why it is important to maintain physical distance of more than 1 meter between people, so those droplets they cannot reach another person. That is why it is important to wash your hands either with soap and water for minimum 40 to 60 seconds, and otherwise, if the hands are not soiled, you can apply alcohol-containing disinfectants for hands for 20-30 seconds. So that's how you can break the chain of transmission through contact way. So that's why you prevent those particles which might contain virus of getting into your mouth and nose, etc. So that's why important to wash your hands.
Dr. Clarinval, I'd like to talk to you about the new pneumonia cases and the spike of the numbers here in Kazakhstan. Just between July 1st and July 15th, there have been 135,000 confirmed cases of viral pneumonia. The health minister, Alexey Tsoy made a statement that these cases will now be accounted as COVID-19. Well, it took some time for the health ministry to respond, although the medical community here in Kazakhstan have spoken up early on. There have been a certain level of public pressure to combine those numbers. Why do you think it took some time for the authorities to admit that these cases were related to COVID-19?
Thank you. I know it's a burning question since a few weeks now. Maybe let's put this back into context. Again, COVID-19 is a new disease. The health system, all healthcare workers, etc., had to get used to understand how do they deal and manage the disease and the patients that get the disease. So that's point number one. So that also comes back to what we call the classification of the diseases. So every disease has got its own code. Since March, WHO has promoted the attribution of a certain code within that international classification of diseases, what we call ICD-10, and most countries have adopted that in a progressive way. So it has taken every health system in every country a certain way for them to understand and to adjust the diagnostics and the recording of the cases according to that new way and that new form of managing these cases. So, of classifying the cases, to be more accurate. So the point is that in Kazakhstan, I'd like to underline that for the past few weeks we've been discussing with the Ministry of Health on how we can support them in order to make that shift. And they have demonstrated an enormous way of forthcoming and willingness in order to align as to how other governments do it as well. I don't think there was necessarily an intention behind it. I simply believe that it takes time for healthcare workers to know how to classify and how to code these cases. And they are now in the process of training the healthcare workers accordingly and to ensure that everybody knows which code to allocate for what kind of patient that they see. At the same time, it's still important that we look into those pneumonia cases of unknown origin. And here as well, we need to understand better why do we have this peak or this spike in numbers of cases. We need to understand whether there is something behind it or not, or are they really truly, as it be assumed that this is the case, related to COVID-19 or not. So that effort in trying to, for us and the Ministry of Health, more particularly the Ministry of Health, to understand what is going on is a laudable effort. And that comes back to the fact that this is a new disease. We all learn every day on how we have to manage it.
Oh, well, the delay in adopting the WHO classifications on the part of the Kazakh government has been very unfortunate for the people of Kazakhstan. It has caused a great public outcry and fury. The mortality rate in these cases has also been quite high. Just between July 1st and July 15, 1,555 confirmed cases of death from these pneumonia. Why has the fatality rate been higher in these cases, Vitalii?
We are aware that the WHO is aware that within the past 7 days, Kazakhstan has reported more than 10,000 cases of COVID-19 to WHO. In the same time, we are also aware about this the pneumonias which were classified as viral pneumonias of unknown genesis. And therefore we are working in the close collaboration with the Ministry of Health in order to understand what are the testing strategies, what are the approaches for testing of those patients who became negative and who tested negative out of those patients who are reported to have viral pneumonia of unknown genesis. So that is why at this stage we are still looking into this matter. It takes some time for us to understand the situation on the ground. So that is why we are about to conduct a mission of which will be focused specifically on the laboratories, on how those patients were tested. At the same time, we are and the mission will also look into the case management matters, to understand how the samples were obtained from those patients, and etc. Indeed, we can assume that when there is a COVID-19 outbreak in the country, there is a big chance that those cases might be attributed to COVID-19. However, at this stage, we need to conduct more thorough investigation and to understand more situation on the ground. So that is why it is important to make any conclusions after we conduct the mission, after we look into the testing approaches, and after we look into the particular aspects of the case management. And we are very grateful for the willingness and transparency of the Ministry of Health, who has also agreed to ship the samples from those patients to the WHO collaborating center in Germany, where those samples will be tested again.
So is it right to say that one of the pressing questions in this matter is that these patients actually tested negative for COVID on PCR tests? So the group of WHO experts who will be visiting Kazakhstan soon will be looking into that. Am I correct?
Yes. So the group of the WHO experts will be looking into the testing approaches, how those patients were tested, which kind of samples were obtained, and etc.
Since we started talking about the testing systems, here in Kazakhstan we know of two available tests. One is the express test that is free of charge, and anyone who has mild symptoms can actually take the test and see if they have the antibodies. And then the other test is the PCR test, which stands for polymerase chain reaction test, which is, I'm assuming, more accurate. What is the difference between these tests, and how should the testing be conducted now amidst the spike in the number of COVID cases?
Polymerase chain reaction test is indeed the laboratory test, which helps us to identify the virus, the RNA of the virus in the tissue of the body. So according to the current WHO recommendations, real-time PCR is indeed the test which is used for the clinical determination whether a patient is positive or negative with COVID-19. It is pretty accurate, and it helps to identify the virus in the human body. So when it comes to the serology test, to the rapid test, at the moment there is no particular serology test which is recommended by the WHO.
Should there be any concerns as to the quality of the PCR test that Kazakhstan procures for its citizens?
For this time, at this moment, we cannot make this as an assumption, because our laboratory mission is indeed going ahead. WHO has supported Kazakhstan with the test systems which were procured by the WHO supply chain, and those test systems they are of very well-known manufacturers, and we know that such systems are used in the national reference laboratories in Kazakhstan.
We've been into pandemic for almost half a year now. What else did we learn about the virus in the past few months?
And at this stage, the data and scientific society and clinical researchers and frontline workers are working hard in order to learn more and more about the virus. We are just half a year fighting this pandemic, so a lot of information yet to come. When it comes to the clinical management protocols, and WHO indeed has released its updated guidelines on clinical management in the end of May, and we are aware that Kazakhstan is reviewing on the regular basis its clinical management guidelines. So Kazakhstan is adopting international experience in compiling the clinical national protocol for clinical management. When it comes to development of therapeutics, reflecting on your question, at the moment WHO is conducting Solidarity trial, which you might have heard of, which is also at the final stages of commencement in Kazakhstan. Now the final approval by the regulatory authorities has been received. So as soon as Kazakhstan is ready to commence this trial, WHO is happy to support, and WHO is already providing technical assistance to Kazakhstan to commence Solidarity trial.
Well, the pressure on the health systems is really growing. The hospitals are running out of beds, they're running out of drugs, but also of staff. What can be done? What would be the appropriate response now to the spike in COVID-19 cases?
It's a very good point that you're highlighting here. And indeed, we have been into this for a few months. Kazakhstan has recorded their first cases mid-March. The system had to adjust to the outbreak very quickly. Doctors and nurses and the entire health personnel had to make an enormous effort in order to maintain services functioning and to deliver appropriate health care. I think it's important that we take this opportunity to thank them for their efforts and for their commitment and for risking their lives to take care of us. I believe that it's not necessary. We sometimes assume that it's a given, right? That it's just, yes, we can go to the doctor and the doctor will take care of us. We have enormous and extremely high expectations towards a health system. And when we are confronted with a disease outbreak, our expectations have to be adjusted as well, simply because the system can only do so much. If the system is being stretched simply because doctors fall sick, lab personnel fall sick, nurses fall sick, because we have got an influx of patients all of a sudden that we have to take care of, the system has to adjust. So depending on the number of increase of patients that we actually have, the system then has to very quickly find ways on where to refer the patients to, etc. What we have observed is that from the beginning, Kazakhstan has been very proactive in terms of testing. They have also tested high-risk groups, and therefore they've had a rather large number of people that were asymptomatic. At the moment, that because of the increase in cases, that approach had to shift a bit. And we have to realize that what is important now is that the health system is capacitated in order to take care of the severely and critically ill patients. We also have to make sure that the population is aware that it's actually okay to stay home when you have a mild or moderate form of the disease. It is okay to try not to overburden the system. What we observe is that sometimes one patient with a mild form of the disease tries different avenues in order to get a test, in order to get a CT scan, etc. But maybe it's also important that we start to reflect, do we need all of this now? Is our condition that bad that we actually have to have access to the full panoply of what the healthcare system can provide? And I think here the population can play an important role in to also help us decongest the healthcare system and to make sure that there is sufficient capacity for the severely and critically ill.
Speaking of thanking the doctors, is it just enough to thank the doctors, or are we providing enough support for our doctors and healthcare workers who are at the forefront of this war against the COVID-19? Are we failing them as well? Is our government failing the health workers as well?
I think it's one of the most difficult moments for this group of professionals worldwide. And I oftentimes think about what can we do more for them. But unless if you ensure that they have all the trainings available, that they know how they can protect themselves, that they have all the equipment available to protect themselves, that there's sufficient staff available for them to actually rotate and to also sometimes rest and recuperate, that the health system is set up in a way that we can cope with peaks of cases, etc., then only there will be enough done for them. So at the moment, I think worldwide healthcare workers are just put under an enormous pressure. And the thing is that because of their professional ethos and because of their principled approach to work and to the patients, we sort of sometimes take them for granted. And I think this is where we have to, as civil society, take a step back, self-reflect, and think, how can we make sure that we are not a burden to them?
Speaking of what we should advise people to do to secure, safeguard themselves, how important is wearing masks?
The mask debate is a very interesting one. First of all, we want to make sure that healthcare workers have access to enough masks. That's why at the beginning we were very cautious in advising the civil society as to whether yes or no they should wear masks or not. So the guideline is that as a person you should wear a mask if you're sick, or if you are taking care of a person that is sick, or obviously if you're a healthcare worker or work in a healthcare facility. And the latest guideline also recommends that people wear masks if they're in crowded places and if they cannot self-distance themselves from another person.
Dr. Clarinval, the reason why I'm asking this, as you mentioned, the WHO at the beginning in March actually, did not say to wear masks for the wider population in fear of disturbing the supply chains, which is the supply of medical masks to the health workers. In retrospect, was that a good decision?
Back at the beginning, we wanted to make sure that healthcare workers have access to their masks because they are the ones that expose themselves the most. Okay, so as doctors and nurses, everybody was allow us to wear our masks, make sure that the supply chain is well enough equipped in order to make sure that the healthcare workers have access to them. And what we have seen is that there were stockouts and that there were disruptions in the supply chain to ensure access to masks for our healthcare workers. And that was one of the key concerns. At the same time, the population could actually protect themselves in simply keeping physical distancing, right? So there was not a necessity back at that time to make sure that everybody wears their masks. However, we have also seen that there are certain settings or certain rural or family or urban settings where the population is simply too dense. And having had a look at that in retrospect, yes, those populations should be able and, encouraged to wear masks in crowded places. But again, it's a new disease, and this is what we wanted to say from the beginning. We are learning every day, and that's why our technical guidelines, they are sometimes updated. For as long as they are not contradicting each other, that's what we want, but we want to make sure that we learn from this, what the situations explain to us, what the science tells us, what the environment tells us in general, and that we include those recommendations into the technical guidelines.
If I may also add here to what Caroline said, I just wanted to highlight that the population should also remember that the mask alone cannot ensure the protection against COVID. So it should be a complex of all the advice implemented in the same time. So the mask alone is not efficient if there is no physical distancing between the people, if there is no hand hygiene which is performed on the regular basis by all the people, if there is no respiratory etiquette which is exercised by all the people.
Vitalii, could you please update us on the progress of vaccine development? Is the vaccine the only avenue to ending the situation, and how's the progress coming along?
At the moment, WHO is working with partners and with research and Development Society, as well as with manufacturers of vaccines. At the moment, there are more than 100 vaccines which are under various stages of development and trials. 8 of them, they have reached clinical trial stage. So, well, WHO continues also and working in improving the access to the vaccine when such vaccine would be developed, and all the corresponding clinical trials would successfully be completed for this vaccine. We are also working on improving access for the vaccine. So therefore, there is a COVAX initiative which supports countries of getting access to the vaccine. So at the moment, this initiative is concentrated on providing 2 billion doses of COVID-19 vaccine to the population in need, mainly focusing on the healthcare workers, on those people who are at higher risk of developing severe clinical symptoms and severe stages of disease.
Until the vaccine is found and is actually available for mass vaccination, preventive measures need to be taken. Is that so?
Yes, so basically that is why WHO recommending rapid testing of all the suspected cases, their isolation of suspected and confirmed cases, clinical care for suspected and confirmed cases, as well as quarantine of contacts of those cases. So those are the basic and essential public health interventions which need to be done in order to halt the spread of COVID-19.
I think what is more important to understand is the length of time it takes for a vaccine to be proven effective and safe. And I think the population, I mean, globally, we have to remember that the vaccine will not be proven effective and safe anytime soon. So it will still take months, or if not years, for us to make sure that actually people have access to a vaccine that is effective and safe. And it's also very important that we remember that developing vaccines follows a very rigorous protocol, and these steps have to be followed, even if under the current circumstances there is a global effort in order to speed it all up. At the same time, we can't jump these different steps just to ensure that we actually don't cause more harm than doing good.
So it's hard to say how far off we are from actually having an effective vaccine at this point.
I believe that we still have to be a bit patient, and I think it's important that we just are aware and that we acknowledge that, okay, good, it will not be tomorrow. So what can we do? We can make sure that there's a number of precautionary measures that we can take at the moment.
When a vaccine is found, hopefully sooner than later, how will the ethical question of distribution be approached at the WHO?
At the moment, they have a committee that has been composed of a number of specialists that are looking into that question, because it's multifactorial. The question will be, where will that be developed, where will it be produced, at what speed can it be produced, at what speed can it be delivered, at what speed can it be administered, etc., etc. So there's a number of questions that still need to be answered. But at the same time, I think what is most important is that we are aware, the organization is aware of these questions, and the organization is looking into it and is addressing them.
There are lots of conspiracy theories related to COVID-19, and WHO is unfortunately part of these disinformation rumors. There are about 4 million social media posts on COVID-19 being a part of the conspiracy theory. What has your personal experience been working at the WHO and coming across this level of disinformation?
Just talking about misinformation in general is a very difficult thing to manage, and it does require an enormous amount of our time in order to make sure that the appropriate and relevant information is being made available. So our work and the work of the Ministry of Health has been to ensure that the people have access to the appropriate knowledge and the appropriate information. At the same time, much of this disinformation, it sometimes diverts our attention from what we should be doing really on a daily basis. So it doesn't help us. It just adds to the workload. It diverts our attention, as I mentioned, and in the end, what we're supposed to do is we're supposed to ensure that Ministries of Health and our own organization, that we're capable in order to provide the best support we can to the Kazakh population. So at the same time, we have to address the misinformation. So what we've done, we have also constituted a group of risk communications with other UN agencies so that we share the workload and that we engage with the others, and that we make sure that there's a bigger group who can actually manage that misinformation, and that there's a bigger group who can also then echo the appropriate information. But at the same time, in the end, it's up to the individual to decide what they want to believe. Our duty is to make sure that people have access to the information.
What do you think some of the hard-learned lessons will be once we come out of this pandemic for all of us?
I believe that globally we've understood that we need to invest more in healthcare. We also need to invest more in the basics of healthcare services. For example, infection prevention and control has been the area of how can doctors and nurses protect themselves, has been chronically underfunded. It has been chronically ignored. I believe now there's sufficient attention that has been raised in order for the health systems to understand that that is an important area to intervene. It's also, I also believe that we have learned a lot that WHO can provide appropriate technical expertise if and when required. If we look at the organization and the ability and the knowledge it has, so WHO is a knowledge-based organization. This is something what I find the most fascinating about the organizations. But managing healthcare emergencies are complex. I also believe that we've understood that they have consequences on socioeconomics. They have consequences in terms of politics. They have consequences in the way that a disease outbreak of this kind can stir, how can I say, urban disturbances, or can even create generous causes of conflict. We have also seen that these health emergencies have an effect on a negative effect on gender-based violence, where we just see an increased number of cases. So we can see that a disease outbreak of this magnitude has a multitude of consequences that in the end we have to address collectively. So it's not only a health response, but it has become a societal response, has become an economic one, has definitely become a political one. It has become a human rights response as well. So I believe that there's many lessons that we have learned. But I think just to sum it up and to conclude, my greatest take-home message is a message of humility. I think we are very vulnerable as a society, and we have to be extremely thankful for the social goods that we have been able to globally access and have access to at the moment. So yes, it's a lesson of humility.
Thank you.
Thank you.